Cameron, let's talk for a little bit about nature versus nurture with children's teeth. Seems like some children just have perfect teeth from the word go, and then some of us, the rest of us, do not, and we have to have work done. Is it a matter of genetics, or is it something our parents are doing? What's going on there?
So yes, both. I mean, there's truth to both of that, right? So you'll see it sometimes even within the same family.
Really?
That 3 of the 4 kids, for example, I could name off several families that we see.
Right.
That 3 of the 4 kids almost have no issues, and there's that one that always seems to have some trouble.
Okay.
So there's definitely a little bit of genetic component to it. It's almost more the bacterial colony in your mouth that are eating what you're eating and then working on your teeth in bad ways. So there's some of that's a little bit of genetics, or just how things develop for you. There's also a load of it that's also how you take care of them.
Okay.
You know, I've got one daughter that's got a total sweet tooth. You know, one of the others just, they like it, and one just doesn't even care.
Okay.
You know, so how we treat our teeth, how we take care of them, all of it plays a role. And then, of course, you have your more isolated cases where a tooth just developed poorly, or multiple teeth developed poorly, and they have more issues because of that.
And is that something to do with the parents when they come out that way?
Nothing that is the parents' fault by any means. It's just something that happened. We usually see, and we can't explain exactly what it was in each case, but it may have been mom got sick and had a really bad sickness and had a high fever, and that affected baby as baby was growing.
Okay.
It can be a lot of things. It can be antibiotic. A child was put on when they were little, or and so it can change things in the baby teeth and the adult teeth. That there are ways for us to deal with them and fix them, but they can present some significant challenges.
So presumably, the earlier that you can see children, you're going to be able to pick up on these things from a very early age, I take it.
Absolutely. I mean, we've got some little twins that are 3 years old, and the first fillings we did on them was before they were 3.
Oh, wow.
And they've been coming in regularly, and things have gotten much better. And so it really depends on the kid.
Yeah.
And it always helps to have a dentist take a look and give you some advice, figure out what can we do. Some it's just a struggle, among other things, with kids, right? That it's just an uphill battle.
Yeah.
But there are a lot of things we can do if we can see it and help you with it.
Okay. Say some child presents with a really, and I don't even know what a bad problem would be, you would know, but say some child does present with something that needs a little extra help. How are you going to help them out?
So what we like to do is first focus on the child's experience and the potential fear, right? So if they've got, for example, a little 4, 5, 6-year-old comes in with a bunch of issues, we're gonna assess a couple things of, is this something where they're gonna be just fine being awake for? Okay. Because if it's a full where we're going to be working everywhere, it may require multiple visits if we're just getting them numb. Sometimes we don't have to get them numb, but we're going to assess that first and foremost to make sure that we don't scar this child. I was scarred as a child. I don't want to do that to anyone else. I can remember the smell of the room when it happened. Yeah. So we want to be very aware of that, and how are we setting this child up to succeed dentally? Okay. With their care the rest of their life.
Right.
And then we're going to look at, okay, is this something that we can do some fillings? Sometimes you need some baby crowns on baby teeth. There's a whole bunch that goes into that, but it really is a conversation with the parent and the doctor of what's best and where are you best helped. Is that something that, we're a general dental office. There are some things that we cannot do. We see a lot of kids, but there are some things that's something that we definitely need our pediatric dentist friends.
So then you refer them on?
Mm-hmm, absolutely. And it just depends on the child and sometimes the parent too.
Yeah. And it's so important to remember that what you just said was so true, that I can remember being very frightened going to the dentist when I was a small child, and that's carried on for a lot of years. The children that are going to come here are going to be made to feel comfortable. They're going to have been here a while, see what's going on. Hopefully they're not going to have that fear.
Absolutely, because most of the times when we see a patient, maybe in their 30s or 40s or even older, that it's been a long time since they've come in, or they've come in and we've recommended some work but they haven't done it, it's fear.
It is fear.
And it's real, and usually we can trace it back to something when they were a child, an experience they had that terrified them, and it's never been the same since.
And I can attest to that, definitely. So, if you have a child who needs some special help, or just generally you have children, please bring them in to see Dr. Cameron here and his colleagues at Aspen Dental. You're going to receive just the best treatment that children can get. They're going to be comfortable. Fear-free is a good phrase. They're going to be fear-free. Thank you so much for spending some time with us today, Dr. Cameron.
Absolutely. Thank you.